On behalf of Caring for Citizens of Alabama, Inc., a nonprofit organization, we want to ensure our community is well informed. So therefore, we're completing cancer risk assessments to be informed. First, we want to give you some information about the cancer risk assessment. Cancer can sometimes appear to run in families, even if it's not caused by an inherited mutation. For example, a shared environment or lifestyle, such as tobacco use, can cause similar cancers to develop among family members. However, certain patterns, such as the types of cancer that develop, other non-cancer conditions and symptoms that are present, and the ages at which cancers develop may suggest the cancer is in fact hereditary in nature and due to inherited genetic mutation or mutations. Advancements in gene sequencing technologies have allowed for genetic mutations that cause many hereditary cancers to be well described, and sophisticated mutation screening can confirm whether a cancer is indeed the result of an inherited mutation. Genetic testing is also performed to determine whether a symptomatic individual with family members affected by cancers have inherited the causal genetic mutation. So, what is hereditary genetic testing? Hereditary or predisposition genetic testing looks for specific inherited changes or mutations in a person's genetic makeup. Genetic mutations can have harmful, beneficial, neutral, or uncertain effects on health. Mutations that are harmful may increase a person's chance or risk of developing a disease such as cancer. Overall, inherited mutations are thought to play a role in 5 to 10% of all cancers. And these particular disease states are known as hereditary cancers, and proper testing can be used to determine an individual's risk. You see, cancer is a disorder in which normal control of cell growth is lost, causing abnormal proliferation of the affected cells. Inherited genetic mutations can increase a person's risk of developing cancer through a variety of mechanisms depending on the function of the mutated gene. Mutations in genes that control the repair of damaged DNA and cell growth are particularly likely to be associated with an increased risk of cancer. Now, some people inherit mutations in the germline, potentially allowing for the cancers associated with the mutations to be passed on. And these mutations occur in two classes of cellular genes: oncogenes and tumor suppressor genes. Often, multiple genetic mutations in a single individual are responsible for the development of hereditary cancers. So, who should get tested, you ask? Well, if you suspect that you or someone you know may have an increased risk for cancer based on factors like abnormal family cancer history or membership to an at-risk ethnic population, such as Ashkenazi Jewish ancestry, you may want to discuss advanced genomic testing options with your healthcare provider. If one of your family members, however distant, has been diagnosed with cancer, there is a chance that you inherited a gene mutation that not only increases your personal risk for developing cancer, but may also be passed on to your offspring, potentially increasing their risk of developing cancer as well. Mutation of the genes known to be associated with an increased risk of developing cancer, like those involved in DNA repair, often result in cancers that appear unique. An individual family cancer history may include a number of seemingly distant cancer cases. This mistakenly leads to belief that the cancers are unrelated and not caused by a hereditary mutation. Here are some benefits of testing. Those who are carriers of hereditary cancer gene mutations may be at risk of developing cancer earlier in life as compared to members of the general population. So, the sooner genetic testing is performed, the more likely it is that this increased risk can be managed appropriately. Now, numerous professional practice guidelines describe increasingly stringent monitoring protocols published specifically for the management of patients in which deleterious mutation has been identified. These protocols may suggest the increased use of routine screening tools like mammograms and colonoscopies. Now, depending on the severity of the identified mutations, they may also suggest discussion of more aggressive options like prophylactic surgical intervention. Remember, your healthcare professional is your most valuable source of information. Here are some common hereditary cancers and general cancers. Hereditary breast and ovarian cancer, colon cancer, APC, BMP-R1A and EPCAM, uterine cancer, endometrial cancer, Lynch syndrome, Cowden syndrome, and Li-Fraumeni syndrome. The process is not long, but the information you gain is priceless. This is a service free of charge. The results will go to the primary care doctor of your choice, and he or she will discuss with you the results. Well, that's it. Thank you for your time and attention. Done.